Imagine you are watching TV on a weekend with families and friends. At the commercial break, an ad about a pharmaceutical product or discovery appears on your screen, suggesting to you to contact your healthcare provider for prescription, followed by a disclaimer communicated in rapid tone and voice and low voice that leaves you confused. Hi, my name is Abdal Doumbia, student at the University of Wisconsin Parkside, enrolled in class CTA 103, public speaking. Healthcare related issues are of great importance to all of us. Listening to this presentation will improve your knowledge. In this presentation, I will discuss in two parts. Part one about the pros, and part two, I will discuss the cons. Part one. The New York Times editorial board argues that pharmaceutical advertising helps educate and inform patients about new drugs, encourage discussions between doctors and patients. Finally, it helps patients take more responsibility for their own healthcare. A survey was done in 2012 by the Prevention magazine, and it found that advertising brought patients awareness to new treatments and enabled patients to talk with the physicians about a condition or a drug when they see an ad about it. So, what is the purpose of pharmaceutical advertising? Josephine Martin published an article named Direct to Consumer Advertising Make Doctors and Patients Stronger Partners. She concluded in her article that the purpose of pharmaceutical advertising is by design to provide fair scientific information to health-conscious audiences and leave them with the choice to make their own decisions. Brent Rallin, a PhD associate professor in Georgia, also discussed the goal. In his words, the goal is to provide balance of giving information to the general healthcare consumer, but then also having the best conversation with physicians, ending in not altering utilization or creating other healthcare issues. Brent O'Reilly's also support that pharmaceutical advertising is a good practice if we can find ways to avoid misuse and abusive use of prescription from doctors and patients. He also arguments that the challenge is to ensure proper monitoring and compliant results to maintain balance in the benefits of pharmaceutical advertising. Transitioning from sharing the benefits of pharmaceutical advertising in the first part, I will summarize what we discussed in the first part, what I presented. Academics and private sources advises that pharmaceutical advertising has a goal and purpose to ensure patients are informed about new drugs, made aware of new treatments, and encouraged to have discussion with the physicians. Part 2. Contrary to popular beliefs, pharmaceutical advertising is regulated by the United States government. However, there are loopholes, and those loopholes are exploited by companies that are excluded from the regulation. Initially, the regulation established by the FDA only concerned manufacturers, distributors, or companies that pack prescription drugs. The FDA, however, has acknowledged that initially it created loopholes by not acknowledging certain industries and has acted to improve its policies. The FDA regularly publishes fact sheets on its website and has a panel named Ensuring Patient Safety Through Reform of Direct-to-Consumer Pharmaceutical Advertisement Policies. It is on the FDA's website. What has the FDA or Food and Drug Administration done? The FDA removed the loopholes that were in the law that enabled pharmaceutical companies to withhold certain vital information when advertising. The FDA is consistent with punishment when there are violations in advertising by pharmaceutical companies. Finally, the FDA has closed digital loopholes that allowed certain companies to use social medias to promote. The impact of pharmaceutical advertising on health and public finances, according to the FDA, are. The FDA noticed the impacts on our health system are. It has noticed that there is measurable misdiagnosis of ADHD and clinically unnecessary use of Adderall. Also found that patients may overly emphasize medication-based solutions at the expense of equally effective lifestyle interventions that may yield comparable benefits. In 2024, the FDA conducted a survey and found that 62% of pharmaceutical advertising were of poor scientific quality. The impacts on private and public finances are. The Congress Budget Office estimated in fall 2024 that when advertising increases by 10%, the government budget allocated to medical expenditures increase between 1 to 2 and 2.3% in the budget of the government. They also found that patients in regions with high pharmaceutical advertising were 40% more likely to switch to heavily promoted drugs without clinical benefit. Also, we can also conclude that $400 rise in expenditure per patient annually in regions that have high presence of pharmaceutical advertising. They are more likely to spend. A memorable statement that I want to finalize this presentation with from Dr. Brent Ralling, is the explanation of the goal. The goal is to find the balance of giving information to the general healthcare consumer, but then also having the best conversation with physicians and not altering utilization or creating other healthcare issues. Thank you for watching.